So I think that the next section here is really, really, what do you do after you've conducted your PPS? What are the next steps, so that surveillance is not surveillance for surveillance sake, collecting lots of data. It's really about having data for action. That's what surveillance is. So really, the importance of having effective communication of your results, both to hospital management and opportunity to give oral and written feedback to everyone involved. There's nothing worse than being involved in data collection and then not hearing back. And also the importance of timely communication, because one of the things that we found certainly is that if we collect the data and it takes us several weeks or months or even more than a week to return, what we hear the prescribers say is, well, it was not my problem, it wasn't my fault, it was another team, not my team. So if we're able to provide timely feedback, that really helps. And when you collect the data, you can create awareness on antimicrobial stewardship. The bottom line for antimicrobial stewardship is about patient safety. Yes, we want to avoid antimicrobial resistance. That's really key. But we also want to ensure that patients are getting the best antimicrobials available for them so that they can get better. If you share back the data, you increase ownership of different groups, taking ownership of stewardship. And you can then use it to develop antimicrobial stewardship interventions. Stewardship is really a leadership approach is important, and also collaboration is really key. Okay, next slide, please, Ines. So in terms of how do you develop stewardship interventions, there's a whole range of ways that you can do this, and with thanks to Ines for and Anne for drafting to putting together some of these slides. In terms of quality improvement, so if you wanted to use a quality improvement methodology to develop your interventions, there is what we call the Pdsa Cycle, which is where you plan, and then you also document. Apologies, I'm struggling to see the whole slide. Ines, can we change to Kieran presenting, please?
Yeah, sure. I'll stop sharing.
Apologies. And I'll start again, Kieran, if that's all. Kieran, is that okay?
Yeah, 2 seconds then. Yeah.
So there was a question here. I'll take some questions. Is there any feedback about number of patients with devices having infections or antibiotic use? Anne, do you want to quickly take that whilst we wait?
Not yet. We have a dedicated person who is developing the feedback report using the statistical program R, and it's linked to our global PPS application. And she's working hard to put in more slides from the healthcare associated infection module, and also other slides. We are continuously actually trying to improve the feedback slides. It's quite some programming, so we have seen it really take some time. By the end of this month, certainly, I think another 10 slides will even be ready for the participants, and not only for the new participants, but important to know for those who are joining, who have participated before since 2015, this will be retrospectively available for you. So it's worth to go online and download a previous report, and you will see the slides, the new slides coming up there as well.
Okay, thank you. Yep. Kieran, can you go back to the start of this session, just for the purposes of us recording? It'll be easier if I start again. So yeah, next one. Thank you. So then that way it can be edited together. So in this next session, we're going to talk about the importance of using data for action. And so there's no point in collecting data for the sake of data, but actually how do you use that surveillance data for action? The importance of effective communication of your results, both to the hospital management and the importance of giving oral and written feedback to everyone that is involved. There's nothing worse than participating in a data collection because we inconvenience the team and then we don't feed back to them. And I also highlighted the importance of timely feedback because that's really important to avoid people saying, actually, that's not my practice, it's somebody else's practice. So if we can provide timely feedback, that is really important for changing behavior. You then use that to create awareness on stewardship, increase the ownership of different groups within the hospitals, getting involved in antimicrobial stewardship. And also, of course, you're using that data to develop antimicrobial stewardship interventions. Next slide, please. And so in terms of developing antimicrobial stewardship interventions, thank you to Ines and Anne for some of these slides. Within the WHO practical toolkit for healthcare facilities, I showed you the policy document. There is also a practical toolkit for healthcare facilities that you can have a look at. It talks about the importance of using a continuous quality improvement methodology. So often that's called the Pdsa Cycle, where you plan, you study, then you take action. So plan, do, it's called the PDA, plan, do, study, and action. So that's an opportunity for you to use quality improvement to be able to develop your interventions. Next slide. So for example, it's when you want to prepare in the first part or part of planning, you identify who your leadership team is, and then you study your quality indicators. So this is really important. You look at the data, your feedback data from your surveillance, and then you just try and identify what your key challenges are and what your key indicators that you want to focus on are. So for example, do you want to focus on the number of antibiotic prescriptions with a documented stop or review date? Next slide. Then you need to set SMART goals within your planning. So remember, your goals should be specific, measurable, achievable, realistic, or relevant, and then timely. So an example is if you collect your data about now, June 2021, then you want to say, for example, by June 2022, 90% of antibiotic prescriptions in our hospital will have a documented stop or review date, or will have a documented indication, or for surgical prophylaxis, we are going to focus on appropriate prescribing of antimicrobials for prophylaxis. Next, please. And then again, your intervention should also be smart to allow you to reach your goals. So how are you going to be able to get to what you want to get to? Is it that you need to think about education, workshops, or having new policies in place, or have a communications plan, or have a monthly report to your hospital management? So, and now these examples are in essence using behavior change strategies, because if you have a policy in place and if you can ensure that that policy is implemented, then you're likely to see an increase or an improvement in the stop or review dates being documented. And stop and review dates being documented is not for the sake of it. If people document stop or review dates, then the antimicrobials are more likely to be stopped promptly. And we know now that we need to stop the usual everybody gets 7 days of antibiotics irrespective of what the indication is, because there is now evidence to show that shorter courses may just be as effective, and we are reducing the time that patients are exposed to antimicrobials. Next, please. And then you need to implement your interventions, which is the do. So actually, you now said you're going to put a communications plan in place, or you're going to have a policy in place, and you develop those policies or plan or education and training sessions and implement them. That's the do. Next one. In the study and adjust, so you obviously part of your prepare is also that you study because you've looked at your data to start off with. You can then perform a repeated PPS and make any adjustments. The one thing to say about quality improvement is that you need to start small. So the way a recommendation around this is that if you collect the data for your whole hospital, you may want to just choose one or two, either one specialty or one ward to implement your stewardship intervention in, if you have the time. Because one of the reasons for that is you may think that writing a policy is going to solve your problem, and it may, but actually you may find that if you implement it within, if you have a institution-wide policy, that's fine, but you may find that you need to make some adjustments to the way you promote the policy for it to have a good effect. So with quality improvement, it's really important starting small and then expanding. But obviously you have your data and then you can see what works best. Next slide. So it's important that you consider behavior change methodology. And there is even within an hour, I couldn't fully teach you on this. And this is a health psychologist spent many years learning this. But I just wanted to highlight to you very briefly if it's something that's of interest. And we often there are different behavior change strategies that you can use, but a common one that we're tending to use within stewardship at the moment is the CwPAMS methodology, which is where you focus on capability. So this is around knowledge. How do you ensure that your healthcare workers have the capability that they need? Motivation. So how do you ensure that they're motivated to do what you want them to do? And then opportunity. I'm going to give you an example. So you want to improve hand washing within your institution. Capability. You have taught people how to use the hand washing. You've taught them the WHO methodology for hand washing. You've taught them the 5 moments of hand hygiene. You've done all that. They're capable. You've assessed them. They're very capable. They're motivated as well because, they want to ensure that their patients are safe, but then they don't have a sink and water to wash their hands. You can see that no matter how capable or how motivated they are, if they don't have the opportunity to actually wash their hands, in the sense that there is no water or there is no sink, then you cannot change their behavior. So this is just one example of how you can consider these different aspects when you want to, again, thinking about prescribing, documentation of indication or stop or review dates. You've taught the prescribers the importance of documenting indication, because if you document the indication, when another healthcare professional comes along, they will understand why you prescribed the antibiotic in the first place. And if they need to make a change or stop, it's easier for them to do that. You've taught them that they're capable, they know what to do, they're prescribers, they're motivated because they want to stop unnecessary use of antibiotics. But then their drug chart is not available, or they don't have the opportunity to be able to write a stop or review date, or to make it easy for the nurses to see the stop or review date. So an example of an intervention that was put in place in the UK, and I know in Zambia as well, is that they now have specific sections of the drug chart for antimicrobials where there's a prompt for you to write the stop or review date and for you to write the indication, as a way to make this a little bit easier for prescribers. So these are just some examples of how you can use behavior change strategies within antimicrobial stewardship. As I said, there's a whole range of information. There is a MOOC, so a massive online learning on this, which is free and available through BSAC, that you can access, and that really focuses on behavior change strategies within the context of antimicrobial stewardship. Next slide, please. So I'm just going to give you some examples. So this is an example from our colleagues in Ghana, and this is confidential, so I'm just going to go very quickly, but it's an example of using quality improvement methodology, and this was led by Fran Kerr and her colleagues in one of the hospitals in Ghana, and has been submitted for peer review. And you can see how you use quality improvement methodology, and you can have a run chart that basically shows you different interventions that they put in place over time. So, for example, they had an app on the phone was one of the interventions. Then they had an assessment of what the barriers are to changes. They implemented new local treatment guidelines. They also had a policy on the wall. So they basically did start small, try different interventions to see what worked best. And you can see there that when they provided prescriber feedback, there was a massive jump in compliance. But over time, there were periods of times when they had drops, and then COVID also was a challenge as well. Next slide, please. And again, this is published from 2 Ghanaian hospitals, which is the Prevalence survey. It's published in Antibiotics Journal, I think. And again, for this, they focused on looking at indications, missing guidelines or guidelines compliance, and then stopper review dates in notes. An example of how they use the GPPS data and presented that widely, and also how they developed an action plan for their hospitals. Next slide, please. So just to conclude then, the benefits of conducting surveillance through a point prevalence, you can do it through global PPS, you can do it through WHO PPS. And in fact, I'll give you an example. In some hospitals that I'm aware of, they don't use the full global PPS all the time. They do an initial one, and then they take aspects of it and use that. And then it does mean that you have to analyze your own data. But they focus on indication and review data, for example, and then just collect the data on those two and analyze it themselves as a way to look at how they're improving quality for quality improvement purposes. And then a year later, they go back and complete the whole global PPS so that they can see how the hospital has improved. Because what you don't want to do is collect your data, put your interventions in place, and you're not monitoring it over time. And then in a year's time, you look at the data again and nothing's changed. So PPS can help you design stewardship interventions to promote prudent antimicrobial use and improve patient health. It can help you to identify targets to improve antimicrobial prescribing and to prevent healthcare-associated infections. It helps you to assess the effectiveness of your interventions through repeated PPS, and also to raise awareness of appropriate antimicrobial prescribing over time. Next slide, please.